thank you very much, Gabriella. I'm delighted to be here and look forward to sharing some of our thinking around what we call the digital determinants of health. I consciously say we because what I will present to you is, of course, not just my thinking, but has the input of the extraordinary staff of the Digital Transformations for Health Lab and many of the partners and consortium members that we work with. And we are engaged in taking this issue forward in a number of ways that I hope I will also be able to share with you. It's also great to be here today when the hub is going to be launched and there is a sort of new stage of health promotion that will really relate and use the opportunities of the digital world and the virtual coming together. So that's quite extraordinary. Our starting point, of course, in terms of speaking of digital determinants is to fully understand how much, and Rüdiger has alluded to it, this technology, not only this one, but other as well, has been changing our lives. And that, of course, relates quite centrally to what health promotion has said, that health promotion is created and lived by people within the settings of their everyday life. And the virtual, the digital, AI, whatever terminology you want to use, is now totally integrated into our lives. And as something that is totally integrated, we have to understand how it contributes to health. And therefore, the way we have phrased this is to say that the digital world, speaking of a digital world, not digitalization, a digital world, is a new sphere in which health is created, but also where health is endangered. And I think there are these two sides for health promotion, sees this as an element of empowerment, of really moving health forward, but has a responsibility to also see where digital determinants actually hinder health. And our work in the lab is mainly on children and young people, the impact it has on children and young people. And I'm underline, and some of the colleagues here will know this, that we also work with young people, that we don't just talk about them, research about them, etc., but integrate them fully into this work. If you look at the next slide, we're just trying to underline also that the digital transformation is a societal transformation. And of course, the start of health promotion has always been that health is, amongst many other things, a social concept. We cannot understand health without understanding the social environments with which health is created. And here on this slide, I want to highlight two very key elements. That on the one hand, we have the major societal transformation that is linked to the development of technology, and some people call this the industrial revolutions. And that we are right now with the new technologies in the midst of such a revolution. And I think sometimes we also feel this disruption that also comes with any kind of revolution. We also have to see that through that immense revolution, a new interface and a new interaction is happening between people and technology. And this is, what we feel and what we fear, particularly around artificial intelligence. And this understanding of how that contributes to health and well-being is absolutely central. So in our work and on the digital determinants of health, what is so important to us, not only to look at the technology it's as such and what it enables, but also to understand the context and to understand that any technological change will also bring a social change with it. And that's very critical. We were able to think about some of these things, and the next slide just reminds us of this, through the opportunity to work as a Lancet Commission on governing health futures, growing up in the digital world. And what we are now doing in our work in the lab is to follow up on the recommendations of this Lancet Commission. And the Lancet Commission, and that's why we're working on the determinants, clearly said digital transformations are in themselves a determinant of health, but they also interact with many other determinants that define the health and future of children and young people. Again, Rüdiger has already alluded to it. I won't talk so much about it in this presentation, but the major equity and divide issues that are part of the digital transformations. There are basically two other families of determinants that we always interface with when we talk about digital determinants. One is the social determinants and all the equity issues and everything else, and the other are the commercial determinants. Because, of course, this revolution doesn't just happen. It's driven also by major interests from major companies. It's driven by profits. It's driven by innovation that comes out of the private sector. And it's driven by, again, these positive and negative factors. So when we look at the digital determinants, and we have a little graph that I want to share with you on the next slide, is that we look at it at three levels. On the one hand, the impact of the application of digital technologies, and here particularly in healthcare and health systems. Rüdiger has also alluded to what that makes possible through data, through monitoring, through all of that. And we run a whole program on digital first health systems that looks at that. We look at, the digital determinants of everyday tech use, and how that influences physical and particularly mental health and well-being. That's very much important for us. And then the digital ecosystems and how they change our lives. And you will see on the next slide how some of those digital technologies are obviously changing how we interact with healthcare ecosystems. And we can see, they do take India, for example, provide improved access to healthcare for underserved populations. We have greater convenience and efficiency for patients and providers. Individuals can get active, can get involved, patient organizations, through the digital applications. And of course, we get nudged. I don't have an Apple Watch, but many of you might, so there's the wearables that are really changing how we deal with it, monitoring, decision-making, diagnosis, and of course, the whole issue of health literacy. And those are elements, that are pushing forward, that are being developed both by startups, by big companies, by individuals, by groups. And I think here, the formal healthcare system is not really ready enough for what is actually happening and what is possible. And the possibilities can be of a great opportunity. But of course, and that's the other thing we focus on, that this everyday use of technology also impacts our health and well-being. And on the next slide, we've just, put a screen, but of course, these screens are less and less the screen we sit in front of at home or at our desks. They are the portability. And that much of the research that actually looks at negative impacts is particularly linked to the portability, is the fact that this is everywhere, that this nudges us everywhere, that we have this feeling we always have to be ready for something. You said, I can find out straight away what Dr. Tedros said in Brazil and check on him. But there are a number of factors around that, and that creates new vulnerabilities. On the next slide, we've listed for you some of these vulnerabilities, and you can see, if you look at that small picture, that's where we asked young people on positive and negative impacts of the use of social media. You can actually see it's relatively evenly distributed, the positive side of it and the negative side of it. And this, I think, also makes it so difficult to deal with this issue, because every time we draw attention to a negative impact that we sort of need to, sort of get a handle on, we straight away get the answer. And that answer is correct. Yes, but it helps young people. It allows for this, it allows for that. And I think there's very few issues in health promotion and public health where the positive and the negative impact are so closely linked. And I think this is really a new challenge for us in health promotion to be able to deal with that. And you can see, of course, these technologies are everywhere. Globally, 1 in 3 internet user is a child under 18. Young people, particularly teenagers, are very keen to be linked up with each other. But we're seeing the younger that children are from the research, the more it impacts on their development. And there are some very disconcerting data on that as well. But also we see that young people are using digital to support their health and well-being. And all the young people we have surveyed and talked to speak particularly about mental health issues and how much the web can help them. Now, we've put together one slide that I hope you'll be able to study after this talk, where we've tried to say and show how diverse these potential harms to health and well-being can be. And I must honestly say, for me, one of the most disconcerting is the one linked to cognitive development. We're seeing that many parents, in actually hoping to foster the cognitive development of their children, are giving them, for example, iPads very early on, with little learning games and all kinds of things. And we're actually starting to get research data that shows this does not help cognitive development. It actually impairs cognitive development. I was in Singapore, I was introduced to a study which showed us that some parents, in the hope of helping their children, and I think this is important, parents want to do the right thing, in the hopes of helping their children, have given them iPads at age 6 months. And they are actually endangering the cognitive development of their children. There's obviously other physical things, like a lack of physical activity. There is the eye health issue that we're not looking at enough. There is disruptive sleep. Addiction, that is often one of the first things people talk to, is, if I might say that, not our primary problem. Our primary problem is really this everyday health, is everyday anxiety, is everyday well-being. And this is, as health promoters, what we always have to keep in mind when we look at the digital transformation. We want, how does this help empowerment? And how does this help well-being, health in everyday life? And then, of course, we have to work with many of the other health professionals, particularly in the mental health area, in relation to anxiety, stress, the kind of everyday things that are going on. And you can see on the red the kind of impacts that young children have to deal with. There's cyberbullying, there's facilitated violence, there's the body image issue, the beauty issues for many girls. There is the marketing of products, direct and indirect. So this absolute link to commercial determinants. And there is a lot of other things Rudiger referred to, information, the deep fakes, many of these things. And the issue are the pervasive design features of many of these programs. And we need to look more at that. Obviously, always, and the next slide just highlights some of that, there's always more research needed, but we feel very strongly there is sufficient evidence to act. I'm not going to go through all these points. You can look at them later, but we really have an increasing amount of evidence that the impact, and again, I come back to the impact on children's brains. And what I said earlier, the very notion of childhood is changing. Those are things that we need to relate to. And maybe, if we just say 1 in 9 adolescents show signs of problematic social media use, I think, if 10% of children, and if you add general anxiety, you have 20 to 30%, then, we've got to do something. Now, in our work, we are talking with tech companies. We are trying to address some of the issues around protection of children. And in talking with tech companies, we've produced this slide. I've also shared the slide with them. I've asked them to comment on this slide. That's important. And the kind of things that they are introducing to protect children. Again, I'll just highlight some of them: strengthen parental controls, anti-bullying tools, screen time management tools. Of course, age verification, but we all know how creative children and young people are, so no comment on that. They're developing child-specific platforms, and I think one thing very important here, they collaborate with child safety organizations, and we've given some examples there, but the issue really is the issue of the design feature. And the design feature is, structured to keep kids online. And I think, this very notion is something that we have to take up much more significantly. And we can see on the next slides that the commercial motives, of course, of digital platforms do not always align with public health. There's excellent materials. We've just highlighted some of those for you there. And there are partners we work with in our program that particularly look at the marketing side of this. And with virtual reality, the sort of indirect introduction of commercial motives also through games and gaming and others is absolutely critical. So it's not just about, addiction, it's about many of these things. Just like in real life, many things influence us, so in virtual life, many are influenced at the same time. So what we've seen just in the last 2 years or so is really growing calls for digital environments to be made fit for children. And you can see again some of those on the next slide. I'm very happy to say that I think we had an up-to-date slide there. Yes, thank you. Because particularly UNICEF and UNESCO have been very, very active in this field. And I must say a little bit earlier than WHO. And so if you look at the UNICEF report on the future of childhood in a changing world, which was just issued 2 days ago on the International Day of the Child, you can see that they say we collectively try and keep pace with frontier technologies, safeguarding children and their lives and their health. And we say that including their mental health must be a priority. And you see many policy proposals there. One of the policy proposals that has gained most attention because it's so closely related to everyday life is the notion of the smartphone-free childhood. And what we can see is all around the world, parents' associations are being created to move that forward. And many of the organizations are actually linking this issue to children's rights. And I think this is really very important. And we actually have to rework the Convention on the Rights of the Child in view of the virtual developments. What we can see before public health got active, and again, you see some elements on the next slide, is that new regulations and laws have emerged with a focus mainly on protecting children's data. That was the starting point, really, also in relation to privacy, etc. And so you can see here examples from the United States, from the UK, from other countries, from the European Union, where there has been the attempt to ensure that children and their data are protected. And this notion of protection and safety is a very, very critical one. So we have a notion of rights, we have a notion of safety and protection, and then we have the other agendas that I have spoken about. And the most critical and starting voice, in a way, for us in health promotion and public health has been the Surgeon General in the United States, who actually issued a Surgeon General's warning: social media may cause profound harm to the mental health and well-being of children and adolescents. And that, I think, has really been an important signal. So if you look at the next slide, while public health has not been at the forefront, we can actually map out what are issues that we should be taking on, both in terms of online risks and harms and health and well-being impacts. And we've listed them when you follow that through later, from those that everyone talks about to the others that are less focused on. And again, I find it very interesting that people do not talk enough about the marketing that's going on. It's one of the least mentioned. And if you think of the interest of children, particularly young boys, in sports, and then the link of marketing there, that's very important. Just as with the health and well-being impacts, you can see everyone, in quotes, talks about physical and mental consequences, but very, very few talk about the neurological development issues. And so there are issues that we need to take up. We do see now that first legislation is being taken up, and we are monitoring those legislations, and we will be working with the Polish presidency of the European Union. They have made this one of the priorities of their presidency, and we are working with them to do an overview of policies and also an overview of research to be able to take this forward. So I'll end with highlighting some elements of ways forward that we think, obviously, as the next slide says, public health must be at the table in shaping new policies and laws. You've seen on some of the other slides that the education sector has been moving, the digital sector has been moving in different countries. It's in different responsibilities who deals with digital rights and laws, etc. We want to make the point in terms of health promotions, health and law policies. Whenever a digital law is being considered, health should actually be at the table, because the health impacts, positive and negative, are absolutely critical. You can see here that some very, very top level policymakers have woken up. I was thrilled when I heard Ursula von der Leyen's speech, when she said, "We will convene the first ever European-wide inquiry on the impact of social media on the well-being of young people." Hey guys, that's a health promotion agenda. We should be out there. We should be writing to Ursula. We should be saying, we know this, we want this, we will work with you on this. And now that the new commissioner has been appointed, that's a European issue, absolutely critical, because Europe is leading in digital legislation and regulation. But many such opportunities might also be in other countries across the world. The Prime Minister of Australia has actually started an initiative There is a safer phone bill on the way. There is a task force that the Minister of Health now of Ireland has initiated, and Ireland also wants to take this into the WHO and have one of the future World Health Assemblies agree on this. So to come to the end, obviously we have 5 action areas of the Ottawa Charter. We'll just highlight those again. And you can see if you insert digital in one way or the other, you can actually, have a lot of develop personal digital health and civic skills, harness the benefits of digitalization. So maybe you want to play around with that a little bit as you move forward. We've also put together one slide for you that we hope will help in terms of looking at existing public health strategies. And we've written a paper on that, on public health interventions to address digital determinants of children's health and well-being. And we said we could do this, taking established public health strategies. We don't need to invent new ones, but we can delay children's use of digital media devices. We can limit children's use of digital and media devices, and we can mitigate the negative impacts. And we've listed on the right-hand side many of the things we could do. And of course, one of the most obvious is, just like we have tobacco-free spaces, we can have device-free spaces. Actually, people have said, you've introduced the notion of settings for health in health promotion. Maybe we need the notion of devices for health, And in some cases, they are positive and they are negative. But I think, many of the arguments we sometimes hear, this is so new, we don't know what to do, is not correct. We have, 50, 60, maybe even 150 years of experience of public health strategies. And what our task is and our role must be, let's look at those and let's see what they can do for us in terms of dealing with the digital transformation. We obviously, and this is a call that takes up Rüdiger's point about empowerment. We need to make sure that young people become empowered, what we call digital health citizens. We are now working with the Council of Europe. The Council of Europe has put digital citizenship as their priority. And we are now working with them on digital health citizenship. If you can just show the next slide on that. And so we are not only looking at the interface of digital and health literacy, we are adding civic literacy. How do you interact with one another as people in a social way, and what rights and choices do you have? So I will end with a call to action. We are suggesting to address the digital determinants of children's health and well-being. And I'll end with these 3 calls to action: 2 digital technology companies to redesign tools and services with children's health and well-being as a central consideration; a call to public health agencies to be much more active to develop public health strategies that address the digital determinants of health; and of course to governments, and this is then with the good action of WHO, to collaborate globally to build safe and healthy digital and real-world environments for children. And that's my very last plea. That is to say, while we work on these digital virtual environments, let's not forget we also have to continue to working on good real-world environments for children. So don't forget, if you take this away, give something else. Where's the playground? Where's the youth center? Where are all those things? And that is absolutely critical, that it is up to us to really make this point. The real world has to be healthy, and the virtual world has to be healthy. The real world has to empower children, as does the virtual world. And we have to, as health promoters, show how they best interact, that one cannot replace the other, and that we need to be sure that this interfaces in a way that really creates, as Rudiger would say, well-being societies. Thank you.